what's something that you wish people who are COVID deniers and specifically anti-maskers, what do you wish they would realize about the American healthcare system?
You know, I think people really trust the American healthcare system. On one hand, that feels really good. It feels good to have people trust me as a nurse or at the time as a paramedic. But if we don't take responsibility for our own health, there's only so much the doctors and the nurses can do to bring you back. And I think that's really what's fueling a lot of this freedom movement, because I think that's what's really happening. People take this as, I'm in America, I'm free, you can't tell me to wear a mask. And if anything goes down, this is the best healthcare in the world, so these people can fix me. And that is the one thing I wish folks will know is, yes, American healthcare is fantastic. It is incredibly advanced, but it is not perfect. And we can only resurrect so many folks from the hands of death. And so we all need to join and, take a little bit of responsibility and ask ourselves, what do you want for the rest of your life? Are you willing to die by yourself on a ventilator for the last 3 weeks of your life, never seeing your loved ones ever again? And if you're willing to do that, okay. And then the next question is, are you willing to have your grandma do that?
Wow. Yeah, that's real. I could respect that for sure. And do you think, I know this question wasn't on the list. I know you're a prep person, but do you think if we had universal health care, anything would be different with what we're experiencing here in America in the epidemic?
I think a lot of things could be different in U.S. Healthcare if we change the economic model. And some folks look at Canada, some folks look at countries across in Europe. Here's the crazy thing is, in America, this is the most expensive healthcare, nearly the most expensive in the world per capita. But if you look at our complication rate, you're very high risk of dying in a U.S. hospital. And I kind of feel grim saying that, but this is statistics. I can't exactly make that up, which we can go into a statistical conversation about how numbers lie, because all numbers lie and all numbers tell the truth. But it's expensive here, and as great of a job as we're doing, some countries are really outperforming the U.S. on how they save lives. So I think a million things can change besides the economics of U.S. healthcare.
And I would assume that wouldn't affect the capacity issues, because universal healthcare is not going to make the hospital bigger, but we see this trend of all the ICUs reaching capacity and people having to give up beds. People are waiting in the waiting room bleeding to death because all the beds are taken.